Um, Thanks, everyone. Thanks, everyone, for making time to be here. I think the agenda today will be that we will just review a couple of changes with the new policies regarding SIGs, and then we'll talk about the SIG-sponsored submissions for the annual meeting. Then we're going to have two groups present, so the military and VA SIG and the LGBTQIA2S+ group will present and just let you know a little bit about what their SIGs are up to and give you some examples about the activities that SIGs can do. And then we'll just open it up for discussion. And I know one of the things that some folks wanted to talk about was the potential of a shared platform for the SIGs to encourage cross collaboration and just as a repository for information. So I know I've met with all the SIG leaders individually, and this has been something that we've talked about too. So just wanted to get people's ideas about that. And Paolo can maybe share a little bit about what he's thinking about. So I think the first thing to talk about is just the changes in the new policies regarding SIGs. And Tom, I'm not sure if you wanna talk about this a little bit because you were the one that developed the new policy.
Yeah, I mean, for those of you that were at ACLP and came to the SIG leadership meeting, it's the same kind of things that we talked about there. There's been no updates from that point. The biggest balancing act has been between kind of um, providing some organizational structure between of SIG leadership and accountability to the ACLP board, but also allowing kind of independence for the various SIGs to determine their own leadership structure and be flexible in regards to that. So um, we would just like named chairs, ideally co-chair as well for succession planning. We'd like the term limits to be there with the acknowledgement that those limits can be renewed. And then just making sure that we have that kind of accountability of reporting back to the board what folks have accomplished on a regular basis, or potentially the barriers that they've encountered or the needs that they may have from the bigger organization to enhance their productivity and to kind of enhance the experience of the SIG as well. So, really nothing new from a structural standpoint other than what we talked about in November, but just wanted to see if folks have questions about that.
And one thing just to clarify, the fixed term limit is 3 years, correct? With the
Yep,
possibility of renewal.
with the very open possibility of renew if everybody's in agreement that this person should stay in the role. We just want to make sure that everybody has an opportunity that wants to be a leader and is appropriate for that role has that opportunity to move up in the SIG. It's often the first kind of leadership experience a lot of folks get within ACLP is to kind of manage a SIG and work closely with other SIGs and things like that. So it's a nice opportunity.
Thank you. Any questions regarding the policies? And I know sometimes it's difficult to keep track of how long people have been in their term. And so we're trying to do a better job of that. So I think one of the things we're doing is revising the form that we send out for the annual report. And because I think the last form just asked sort of what term you were in. So I think what we'll do is we'll try to maybe get the year that you started to the best of your knowledge, and then try to, keep a little bit better
Yeah.
track of the term limits. So Andrew, you have a question?
Yes, I was just going to ask, if I remember right, Tom, during the meeting at ACLP, was there a slide deck or a PowerPoint, or am I making that up? Could you
Well,
share that by chance?
sure.
Awesome. Thank
Can
you.
I get that? Ann, I'll send that to you and you want to get that out,
Sure.
folks? Okay.
Yeah, I think I just put it on the listserv, right? Should be able to do that.
Yeah. Thank you,
Thank you.
Andrew.
Okay. And then the other thing I wanted to talk about is just the SIG sponsored submissions. Because again, this came up, quite frequently when I met with individual SIG leaders. People were sort of wanting this to be brought back. And I think one of the reasons why we didn't have it is because it was hard to keep track of what was really SIG sponsored, because there'd be ones that were SIG sponsored, but the like the chair of the SIG wouldn't even know about the submission, right? So it was just hard to sort of keep track about what really was legitimately SIG sponsored. And so I think that, and then it was just complicated. So basically we had gotten rid of that for a brief period of time, but then now in conjunction with the annual program committee, we've decided to bring that back and allow folks to have one sponsored submission for the SIG that would be identified. Doesn't mean that you can't submit more, but you will just have one SIG sponsored one, and we're going to pilot that this year and see how that goes. And so you should have information about that. Larkin sent that out to folks. So you should have instructions on how to go about doing that. So any questions related to that?
I'll just add that I think the program planning committee thought very hard about how to make this as fair and transparent as possible. I don't know if any of you were on the old annual planning committee, but what Ann said is really true. There were just lists of SIG sponsored submissions, and then when we would do kind of due diligence and go back and check, leaderships of the SIGs had no idea. So this is really our attempt to put some governance on that. Make sure the best ones are being brought forward, that the SIG together picks the one that they want to present from a quality standpoint.
But again, if you have more than one submission, there's no reason you can't include that, like in your description when you're submitting the proposal, to say that this is the work of, various people from this SIG, because that maybe will help the proposal as well. Okay, well then, typically in these meetings, we have a couple of the SIGs present just as far as what the activities they're up to. So again, I mentioned there's going to be two SIGs presenting. So Mark, I know you had a time limitation, so I'll have you go first. If you want to tell us a little bit about what your group's been up to.
Yeah, thank you very much. So anyway, I'm co-chairing, vice chairing the LGBTQ plus SIG with Emerson SIG, who's not able to make it today. We're a relatively new SIG. I believe it was the annual meeting 2023 that we had our first convening as a SIG. And so one of the things that would want to discuss in terms of what we're doing now is just how much the landscape has changed in LGBTQ plus health since that time. And so when we were developing the SIG, building the SIG, sort of developing and building on the work, the existing work in LGBTQ plus health, kind of across specialties and public health and best practices, and how that informs CL work and integrated care work, that environment's really changed. And so the last year or so, the activity of the SIG has really been focused on, number one, trying to understand the implications of all of those things for people practicing in CL psychiatry, understanding how it's impacted the members of our SIG. These are, changes in the regulatory environment, clinical environment, academic environment that have had a lot of personal and professional impacts on our members. So, one thing I can't underscore enough is how important and positive it's been that the SIG has been in place for all of these changes that people are experiencing, and supporting people, particularly in parts of the country, who may not have easy access to other resources in their community that allows them to think through how these changes are affecting their work and their practices. So it was a very, so this last meeting that we had in November at the annual meeting was, well attended, very sort of important to people, I think, to start thinking about how are these changes impacting folks, how is it impacting our trainees, has been another really important aspect of it. And since then, we've, I think, been trying to focus down on how does this impact all of these specific elements of our practice. And so now this is becoming our focus for the annual meeting and for our abstract submissions in April. So what we're planning on doing, what we are doing is submitting an abstract for a pre-session skills conference, because one of the things that it seems like we are getting asked a lot about in our professional spheres, we often get questions about LGBTQ plus care, gender related care, in many realms, but now there's additional questions about how do you practice well in these areas, in integrated care settings and in CL settings, in a different regulatory environment, academic environment, and just kind of the nuts and bolts of that. So that's going to be one of our submissions. And then we're going to, our SIG sponsored submission is going to be focused more broadly on the different elements of CL practice, particularly around education, because this is something I it's I'm very interested in hearing, how this affects other folks' experiences with their trainees. But I'll say at NYU, this has had enormous impacts here on our trainees, both trainees who are members of the LGBTQ plus community, as well as outside of that community. A number of large academic programs, including Langone, NYU Langone, actually just in the last couple of weeks have closed down major parts of their LGBTQ plus healthcare programs. And so that's had a lot of ramifications. It's had a lot of mental health ramifications for our patients, and we see that in lots of different settings. So the education aspect is going to be one element of that. The impact on our patients who are coming into healthcare settings, inpatient, outpatient, how that affects their experience and their expectations of coming into the hospital, how it affects the experience of the staff taking care of them. And so a more sort of like, a session that's really intended to provide a lens through which the CL community can think about taking good care of our LGBTQ plus patients in various kinds of settings. So those are our two major projects right now. I think what we're trying to do over the next year is, because of course this is all evolving and it's still changing very quickly, and it's changing at our individual medical centers, and it's changing differently in different geographic areas, is to continue a needs assessment of our membership, of our SIG membership, of our CL community, and to try and define other ways, other products that will allow us to provide best practices to our CL community when they're doing this kind of work with our patients that we're seeing in different kinds of settings. So I'm hoping that the opportunity to make these abstracts will allow us to think about what are the other kinds of products that we can generate for the organization as well.
Thank you.
Yeah, that's great. So one of the things I'm always curious of, and I just got done speaking to the structure of various SIGs. What's the structure of your SIG? Do you have a chair and a co-chair, or two chairs? And do you have small subgroups that help you develop these shop proposals? What have you found most functional to accomplish what you're doing?
Yeah, so the chair is Hermes Fonseca. I'm the vice chair, and we do have, I think, 5 working groups, which I can pull up. So for the purposes of the meeting, we have assigned participants who are going to be working on each of those 2 submissions that I mentioned, the skills and the SIG sponsored session as well. So we have a working group on community, which is focused more on, I mean, there is, as I mentioned, an important element of our group, which may be a little bit different from other groups, is actually thinking about how we support each other, because it's a community that in the best of times has had difficult experiences working within medicine, but it's now particularly difficult. So that kind of like social support element of our SIG is a little bit more explicit maybe than in other SIGs. We have an education working group. We have a research and academic writing working group. We have a clinical peer supervision group, which is focused on early trainees. And then we have early career people and trainees, and then advocacy, which is thinking about how do we think about how to translate what we're doing into public work within the community, to the extent that that's possible, but thinking about, how do we work within our organizations at an organization level to ensure that our observations are leading to, good policy.
Thank you.
Great, thank you. Yeah, and I think it's helpful for all the SIGs, the groups that have been like particularly productive to see, how they're structured, and think that's helpful for folks to hear. And then I also want to highlight too, I think that the website for your SIG is very well done. And I think it's been updated recently. So just would, encourage people to take a look at their websites and just give us any updates that you have on the website. And you can look at, LGBTQ plus, I think is well done. Proactive psychiatry has been recently redone and has done well. So I would take a look at those and if you need examples. So great. Does anyone have any questions for Mark? Great. All right. Well, thank you for all the work that you're doing, Mark.
Okay, great talking to you. Thanks.
Thanks. Okay. And then we'll move on and we can hear from the military and VA SIG.
Hi, thanks, Anne. I'm going to share my screen and I'm going to turn it over to James.
Outstanding. So military and veteran SIG, we have our co-chairs present, Sophia Mata, and she's at MGH Home Base in Harvard, and I'm James Rustad, and I'm with the White River Junction VA, Vermont VA, and also on faculty at Dartmouth. And we can switch slides. And before we jump into some of the stuff we've been doing productivity-wise, just wanted to say it's been an excellent think tank, this military veterans SIG group. And Sophia has been co-chair now, I believe on her second term. It was initially started by Eric Devon and Shannon Ford, and this was pre-COVID, and the group's been building and building over the years. And I think one of the great things Sophia has identified is, how to train the rest of us to be great mentors, and also, identifying future leaders for the organization. So we actually have something that's called an executive committee, and I started out on the executive committee, and it's basically 4 of the members, and then that's kind of identifying future leaders of the group. So now I'm co-chair, and we've identified a very talented psychiatry resident, Michaela Brafford, and she's going to serve as our SIG secretary, and she actually matched at the Dartmouth Fellowship Program for CL, so we're excited about that, and I'm going to be recruiting her to stay on as the VA CL psychiatrist, as the main inpatient CL psychiatrist is retiring in about a year. So perfect timing. And so basically, we've been really focusing with the stellar guidance of Ted Stern on being a publications workhorse, and we focus on military and veterans topics, but really any topic that gets our interest. And we all have unique hobby horses that we bring to the table. I've been presenting at APA for years on catatonia, and also been publishing on that topic. So that's something that we focus on in our group. And there's other topics as well. If we change let's change the slide. So here's just some examples of some of the stuff we've been doing just since the ACLP meeting in November, some of the publications that have come out. And so we have facilitating academic success for practicing clinicians. So I was on the, working on getting academically promoted at Dartmouth, and now I'm associate professor. And so I kind of shared my experiences in this manuscript on the best ways to prepare your resume, and that really goes along with our focus on developing future leaders in ACLP and really in APA too, where we really want to think of things as one APA and one psychiatry. Also did an article on impulsivity and rage. And we really try to use the work that we're doing at the VA and at other, military bases and places like home base, and use those cases and our clinical wisdom to inform what's going on in these manuscripts. We did an article.
Can I just add?
Yeah, please.
It's really important that a lot of what I have adopted and adapted for the military and veterans SIG are things that I learned from the critical care psychiatry SIG as well as the neuropsychiatry SIG. So there's a lot of cross-pollination, and we've taken a lot of the best from other SIGs. And so you don't have to reinvent the wheel. And I think that in discussion with Dr. Schwartz, what we had discussed is that we see the challenges of working within consult psychiatry, and especially also working within military treatment facilities or in VAs, where you may be the only CL psychiatrist or practicing in silos. And really, our monthly SIG meetings might just be about getting together rather than we do tend to have, an agenda, but it's really about breaking down those silos and getting together and uh, having a coalition of people that you can count on and consider your friends as well as your colleagues. So it becomes a place of connection, very similar to what Dr. Bradley was saying. So I think that, the more that we can reach out across the aisle to other SIGs, I think the better the whole entire ACLP will be. Sorry, James.
Reaching out across the aisle, what a novel concept.
Yeah.
Love it. But yes, the cross-pollination with other SIGs is certainly outstanding. And again, on a lot of these articles, we've been getting trainees involved with the publication process and getting them into the SIG as well. So really developing not only the past and present, but the future leadership of ACLP and our SIG as well. And one of the articles I wanted to focus on was a really interesting one about people that are using DoorDash to go against dietary orders that they have. So they have dietary restrictions for cardiac disease, and they'll be ordering pizzas or ordering stuff online that they're not supposed to be having. And so some guidance for how to manage those patients. We can change slides. And I think I'll kick it to Sophia. I'll put a plug in for our talk at APA on catatonia with James Bourgeois, who's also a member of our SIG, and that should be really cool. So look out for that.
Yeah, so as you may or may not know, I'm the chair of the scientific program committee for the APA. So the military veterans SIG has a number of abstracts that were selected. I did not vote on any of these, just so you know, I had to abstain. So I was not the reason why any of these got through. They got through on their own merit. And, based on the webinar of ACLP, we know how competitive it can be. So, but you can see it's about trauma, TBI, toxic exposures, spirituality. The Art of War, the Art of Peace is one that is being led by Dr. Shannon Ford and Lynn Boone. So the chair emeritus of the SIG and one of the executive committee members. And it's looking at math and the use of art therapy within trauma healing aspects of treatment. And I do want to mention that I, wanted as the SPC chair to reach across the aisle and have CL psychiatry more formally recognized. And this was actually a result of being at the APA in May and stumbling across the critical care psychiatry SIG presentation with Jordan Rosen and Melissa Bowie. And I was just walking by and I was like, wait a second, why don't I know about this session? And I'm sure that I did, and I noticed it. So I really wanted a way to highlight different subspecialty tracks. And so because I'm CL psychiatry board certified, I was like, let's do CL psychiatry this year. So it is something that's going to be a rotating subspecialty. But so what I can say is that we managed to have an entire track of 6 invited sessions, and recommended that Phil Muskin and Michael Bostwick co-chair the subspecialty invited sessions at the APA. And this is not known yet, but these are the 6 sessions that were developed by the subcommittee chairs. And we'll notice that Durga Roy is there with bringing precision medicine to CL psychiatry with emerging biomarkers and neuropsychiatric disorders. But really, it's wanting to make sure that ACLP and CL psychiatry as a field is more better recognized within the APA. And then I'll turn it back over to Dr. Rassad.
Okay, so what lies ahead? Still working on a lot of different manuscripts and working on an impact of suicide in military veterans, a scoping review. So Dr. Mata and also Dr. Bradford, the trainee, with others in the group have been doing these amazing comprehensive scoping reviews using specialized software, which are really capturing a lot of data and providing useful clinical information to help guide us as we go forward. There's also a webinar coming up about acute stress and PTSD in critical care, and one on serious suicide attempts. We're working again on ACLP how-to guides. I know we put one together on TBI that's been pending publication for quite a while, but also have another one in the works on ASD and PTSD. We do plan to revamp the website, and perhaps, I'll contact some millennial or Gen Z support to help with that. And we have guidelines and evidence-based medicine subcommittee. One of our members, Julian Rafful out at Stanford, is participating in that. And like we mentioned, the ongoing collaboration with the other different SIGs, thanks to our dynamo, Dr. Mata.
I think that's it.
All right, fantastic. Thank you. You all have been incredibly productive. But I think both groups just sort of, demonstrate kind of the range of activities that SIGs can be involved in, from discussion groups to manuscripts, how-to guides, research, presentations, podcasts, clinical guidelines. I think you saw all of the examples. So I hope that this sort of gives some of the other SIGs some ideas about things that you could work on for the coming year. I know there's a couple of questions in the chat about the SIG sponsorship. So Kent, the question was, could more than one SIG sponsor a submission? And so I think it's just, let's see, Kent wrote something in the chat.
Yeah, I can answer it out loud.
Okay.
So I'm looking at the application, the submission right now. So it asked the question, is this session sponsored by a SIG or a subcommittee? And then if so, there's a separate form that the SIG chair will need to fill out. And so what it'll be is, if it is co-sponsored by more than one SIG or more than one group, then that group will need to submit. Each chair will have to submit for that specific session.
So they would submit the session twice if it's sponsored by two?
So the submission itself is submitted one time in the submission platform, but then there's the second form that the chair will have to complete, that it's separate from the actual submission of the abstract. That just is like, what SIG is sponsoring this, what is the name of the abstract, and then describe how this is a product of your group.
Okay.
So that way, so if it's sponsored by both, by two different SIGs, then each SIG chair will fill it out and then list the same abstract title.
Okay.
Just
And then
sorry.
a forum or a caucus could also sponsor a workshop as well, correct? It's not just SIGs.
I believe so, yes. But I'm gonna defer to Tom on that.
Yeah, I mean, I think it was just limited to committees, subcommittees, and SIGs without the thought of whether forums and others are part, but it makes sense that they would be included in this. I just don't want to lean over our skis and promise anything without talking to the annual meeting committee and just make sure we're all on the same page here. Like I can see the question coming up, if two SIGs sponsor one abstract, does that count as 0.5 for each SIG? And do they get another one I just want to make sure that we're all on the same page with how we approach this. And I do not want to promise anything without talking to the meeting committee.
If you want, Tom, I'm happy to follow up with Larkin and crew and see if their thoughts on that, on both.
Yeah, that'd be great. And then there was another question as well in the chat that I thought we needed to bring forward.
There's one about how SIGs select the one sponsored.
Okay.
Yeah, which I think that ultimately is going to fall to the chair
Yep.
of the SIG to determine that. And so I don't know, how people want to determine that, but ultimately that'll be their responsibility to select sort of what one is going to be the
Yep, it is. It's the chair's choice on which of the form they're going to sign off on that form, and how they want to utilize their SIG to help select that. It's really up to them on how they do that.
Any questions for military and VA SIG, or any other questions about this SIG sponsorship? Okay. Well then, like I mentioned at the beginning, one of the other things we wanted to chat just a little bit about was the potential of a shared platform for SIGs to encourage cross collaboration and just a repository for information. Because I think what happens is each SIG sort of develops their own system, whether that's like a Google-based platform or other platform, and then sometimes it's someone's own personal platform, personal account. And then sometimes if the leadership changes, some of the work that the group has done gets lost. And so I think that's something that a lot of the groups have been talking about. And so I know Paulo has thought a lot about this and has a lot of ideas. And so maybe I'll give you the floor for a couple minutes. You can talk just a little bit about your thoughts about on this topic.
All right, thank you so much. And I've been thinking a lot about this. Basically, what are the main constraints here? Everybody in this room either is using AI, will use AI, or will be forced to use AI. Right? I mean, it's just going to happen. The genie is not going to go back in the bottle. And what I think for us as SIGs, the main points that we need to work on is on data integration, the way I see it, right? So within the HIV/AIDS SIG, we have over 700 members. There's over 6, 7 different time zones, people with different institutions, different policies. And if we start to review the emails, it just gets lost very easily, right? So what we've been thinking about doing, and I don't know how much it would be like an institutional ACLP platform, kind of we would have like a solution for every SIG to use as a template, or if we should just pilot among ourselves, and then show the results eventually. But I was thinking about having like a shared drive source, like a Google Drive, and then we can. I'm thinking about developing a guidance document on best practices on use of AI for integration, chat utilization instead of email sprawl, and having a repository for templates on meetings, for the minutes, for various submissions, and things like this. I think as SIGs, we are overlapping work that we could be sharing among ourselves. And I met with Patrick from the Quality SIG, and he seemed to be interested as well in discussing this kind of initiative because they're trying something at Pitt using agents and whatnot. So that's much more advanced. What I'm discussing here is really uh, how much support and interest we would have in the academy to pursue this kind of initiative, which I know it's going to be fruitful and necessary eventually. And then my biggest asking is really how much on the website can we be ambitious about? Because in as much I love the concept of having a nice looking website and information, the minutes and all the basic stuff, within 12 months, this is going to evolve so rapidly, and people are going to be using their agents and other ways to interact with data that's changing so rapidly. And I want to be ahead on that game and have our group, which is very productive. We have a number of workshop submissions. We just got our book published. We have another one coming in 2 years. Various annual meetings from WPA, now the European Association as well. So it's not possible for me and Luis as chairs to be managing all of this. We have a huge number of work groups and junior trainees who want to become co-chairs, early career co-chairs, and all of these things. So what I'm proposing here is, should we have like a members-only website platform that the members could go there and get access to the minutes and more private information, ways to contact people involved in specific projects, a potential dashboard with what our SIG is working on, and then ways for them to track and improve transparency. Because a lot of people reach me, hey, I want to work on this project, that project, but I'm pretty sure if we had a way to publicize this in a private section, we can't make this public because then it's going to be crawled by various bots and whatnot, and then we're going to lose the originality of the ideas. But could we have like a members only section that members could just go there and I can talk to anybody on how to implement the technicalities of it? It's much more, is this something we are pursuing, like a database, members front only, versus a public version that everybody can see. So it's adding this additional layer would open a lot of options for us implementing AI solutions and facilitating the communication. Because really the major nightmare is just the I'm going to have our meeting next month, and I wanted to hear from our group how far we can go in that. So I can get them really to start working on building up if I have this space. So Chant, I think you raised your hand, and you are the man I'm looking for. So ball in your court, sir.
Kent, you're on mute.
Yeah. Okay. So I think there was multiple questions in there. So I'm going to try to make sure I answer a couple of them. The easiest one being, is there a way to do a members only page on the website? Absolutely. A lot of the pages on the website are already restricted based on member type or committee membership or whether or not they're a fellowship director or not. Setting that up is very easy. The second part of that about having a communication platform, I think is a bigger discussion, one that we're having already within the board. I think it was based off your SIG report from the annual meeting that we've been talking on. I've done a ton of research, and I have a proposal into the executive committee who's meeting tomorrow. Basically, when I look at it, there's 3 different tiers of communication platforms. You have something very similar to what we have now, a listserv or like a Google group type of platform. And it just is a distribution list email that goes back and forth. You have tier 2 is more of a collaboration or project management tool that may not be specifically for associations or nonprofits, but may be able to be utilized to get the job done. Something like Slack, Microsoft Teams, or even Basecamp is kind of like the first 3 that come to mind. And then you have a tier 3, which is probably more of what you're looking for, but it's a very robust, almost like message board type hub that you can set up through. It's built for associations and nonprofits, for membership organizations, that you can basically take the functionality of the listserv. It runs like a message board, but then you still have a spot for collaboration, documents, hosting of your minutes, things along that line. So I think one of the questions that I have in front of the executive committee for tomorrow, and so I'm kind of glad I sat through this today, is what all are we wanting this internal communication software to do? What functionality does it need to have, so that we can determine which of those 3 tiers we need to be at? So then I can then go and do the work of finding software tools that will meet that need.
Yes, I think it'd be helpful to hear from all of you, like how might you use such a platform, and then we, that can guide us accordingly.
I can just spit a quick template from our group, and I'll give Indra a chance to speak as well, because I think she raised her hand. For the HIV/AIDS SIG, we need a place to have shareable artifacts, meaning PDF reports, spreadsheets, and the dashboard functionality on the website, which I can easily set it up. That's what I'm looking for, meaning transparency for people to see at what stage our project is, and a way to click and message the person responsible for the project management of that initiative. That's the number 1 priority, because that's going to remove a lot of my inbox redundant work. Second one, the artifacts, right? The publication PDFs and is basically a shared drive, easy to resolve. And if we can get the communication platform, I really dream of having a way, instead of email communication, people can just go into specific topics or forums, and ideally with an AI summary that the project manager can just summarize the conversation and then create the distribute tests later on. That would be like the last level, Kent. So I can always ask. I will go as far as we can fly, right? And we have teams of people working on various projects. We have new people who want to work on those things. I just wanted to gauge the level of interest, and it seems like there is an interest, and there's discussion now on the methodology. So I'm going to meet with my SIG and start to recruit and confirm, actually, with the needs assessment, who is going to be involved, so I can circle back to y'all. And based on what you give me, I'm going to assign people for the pilot, right? So I rest my case. So in there, yeah.
I'm really grateful that we are having this discussion, because I think one of the things that we've struggled with, a huge SIG, 1,000 members at this point in time, again, people with great ideas. So one of the feedback, we do an annual survey of the SIG after we're done. There was a change in leadership. I have to fill in big shoes after Durga Roy, and the baton was handed to me and Samya. So I think one of the things we started off was doing like a survey, and one of the big things that members, the thing that they wanted was having access to some form of a document where they could get in and kind of, people are logging in from New Zealand, Australia, all of that. We want our SIG to grow, and we're proud that we have members from all over, just like Paolo is talking about. But I think having like a centralized place, we're using Google Docs right now just because of the capacity and the storage. It's much bigger than Microsoft Teams. So I think this is something we've had an ongoing struggle with. And I think, Paolo, like you were talking about having, people who are doing scholarship work and other new people that are joining in, and when you're revamping and changing things. So I think it'll be really a fruitful effort to be involved in. So if the board is looking for ideas and for us to work on, we'll be happy to pitch in. But I think this is a really great and a big initiative going forward. And how do we reduce the amount of time we as SIG chairs and co-chairs spend in being able to organize this ourselves? So it's a big time commitment.
Thank you, Tom.
Yeah, I'll just kind of second this. This was heard loud and clear when we met in San Antonio, that this is something that the SIGs needed. We've outgrown the listserv the utility of using listservs, and I think that this is the next step. I can't pretend to understand how AI is going to function in all of this. I think, we've charged as an executive committee, Kent, to kind of look into this kind of shared communication platform that we can utilize at the SIG level, at the committee and subcommittee level, and at the forum level to enhance committees and to enhance the functionality of these groups. I think what we may ask is if there's a small group of this leadership structure that would like to help vet the communication tools that we come up with as a board, I think will be very helpful to us. And we just to be very transparent, cost is a consideration with this for our organization at this time. So we're going to have to that's going to be taken into account as we look at what we're going to be able to afford in this next year. But this is something that we're really looking to explore. You were very, very clear in November.
Great. Thank you. Robin?
I think the other thing is actually a platform to hold the meetings. Many of us are using our own private like faculty to do the Zoom. So the challenge is, so this past SIG meeting, I was ill. I actually had to take the day off, but I still had to sign in and attend the meeting sick because Damien couldn't log into my faculty Zoom. So even if we had a shared platform that allowed us to do video visits through ACLP, I think would be like really helpful. Or an external, like even an external Zoom link that we as the leaders don't have to be, like if one of us can't be there.
Yeah.